Have you ever witnessed someone suddenly lose consciousness, perhaps collapse, and then experience uncontrolled movements? It can be a very alarming experience, leaving you wondering about the best course of action and how serious the situation might be. Yes, you should absolutely seek emergency care for a first seizure. If someone experiences a seizure for the very first time, it is crucial to call emergency services immediately, such as calling 911 in the United States, to ensure they receive prompt medical evaluation and attention. The primary reason for seeking immediate medical attention after a first seizure is to identify the underlying cause and rule out any serious conditions. A first seizure can sometimes be a symptom of a more critical issue, such as a head injury, an infection like meningitis, a stroke, a brain tumor, or even severe electrolyte imbalances. Medical professionals can perform tests like an electroencephalogram, often called an EEG, and brain imaging, such as an MRI scan, to investigate these possibilities and determine the appropriate next steps for care. When a first seizure occurs, your first action should be to ensure the person's safety during the seizure itself. Help them lie down on their side to prevent choking and protect their head with something soft. Loosen any tight clothing around their neck and remove any nearby objects that could cause injury. After the seizure ends, stay with them, speaking calmly and reassuringly, until emergency medical personnel arrive. Do not attempt to restrain them or put anything in their mouth. It is important to remember that not all seizures indicate epilepsy, which is a chronic neurological condition characterized by recurrent, unprovoked seizures. A single, isolated seizure, also known as an unprovoked seizure, might be triggered by factors like extremely high fever, alcohol withdrawal, or certain medications. However, only a thorough medical assessment can differentiate between these possibilities and determine if further treatment or long-term management is necessary. Prompt emergency care ensures the person receives a proper diagnosis and the best possible outcome. Taking immediate action by calling for emergency medical help after a first seizure provides a vital opportunity to understand what happened. This initial evaluation can lead to early diagnosis and intervention, potentially preventing future seizures or addressing any serious underlying health issues, ultimately safeguarding the person's long-term health and well-being.